On August 27th, Hurricane Laura came ashore in Louisiana as a Category 4 storm, one of the most powerful in U.S. history. With winds at 150 miles per hour and a storm surge of 15 feet, Laura killed at least 22 people in the U.S., leaving hundreds of thousands without water or electricity and $9 billion in damages in her wake. Peter Dancy is director of the Alexandria VA. On Friday, August 28, despite the best preparations, he learned that his facility was no match for the storm.
Really, the first indication had to do with our generator. Secondarily, we had challenges with our sewer system. We had to make a decision very quickly that in order to continue to care for patients safely, we needed to evacuate our patients.
I got a call late Friday afternoon from our network director, Dr. McDougall, saying that we needed to evacuate the Alexandria facility and that she needed me to lead on that. So I quickly reached out to our Vision Pharmacy executive to ask him to coordinate the medication management between the sending and the receiving facilities. Our Chief Health Information Officer to ask her to prepare to make sure there was medical record access between the locations. Also our bed management system lead, and I said I need all the information on how many patients we have at Alexandria and how many beds we have at all the different sites and the types of patients and types of beds. And while they're working on that, I reached out to the Alexandria facility and had them to start triaging the patients clinically by their acuity, severity, by type. And then I was able to match those up and propose a plan for how we would move which patients where.
Those are critical calls that have to be made, but they're made in the interest of patient safety and staff safety.
Always focused on patient safety. That's the ultimate North Star. And then we all stayed up together all night and worked together to make sure that the transportation happened, the patients' needs were met. They had the supplies with them, the nutrition, the equipment that they needed. I believe I can say nobody rested until the last patient was tucked in.
We have staff that are veterans themselves and non-veterans that have sustained damage to their homes, uninhabitable homes, yet they're still here, they're serving, and that, I think that speaks to the level of commitment to our staff for sure. They could very well choose to say, I'm going to stay home and not come in, but they've chosen to come in, and for that I'm very, very happy for.
My heart was overwhelmed with gratitude, just a flood of gratitude for everybody that participated and continues to take care of these patients.